In the event of a flu pandemic, day-to-day services may be disrupted, including those provided by healthcare facilities, banks, grocery stores, pharmacies, restaurants, and government offices. Since you may not have full access to medical facilities, it's essential to have a medication kit at home. There are pre-made kits available from various sources on the internet, but you can easily assemble the things you need to make up your own kit. You can then tailor it to your family's particular needs. It's a good idea to discuss care options with family members and other loved ones. If you intend to bring others into your home, find out what health supplies they require and add those items to your medication kit. It's also important to create an emergency health information sheet for you and your family members. Include blood type, food and/or drug allergies, pre-existing medical conditions, and a list of current medications for each member of your household. Information regarding current medications should include name, strength, dosage and frequency of medication, name and phone number of prescribing physician, name and phone number of dispensing pharmacy. You may also want to create a sheet to track medications given should someone become sick. Such information may be helpful to healthcare professionals if that person needs additional care. Keep prescription medications filled. If you or anyone else in your household takes prescription medication, don't wait until it's finished to order more. Keep at least 1 month's supply on hand at all times. For help with fever reduction and to control pain, you'll need to include acetaminophen, such as Tylenol, and ibuprofen, like Motrin, in your home medication kit. You should also include stomach remedies, cough and cold medicine, and anti-diarrhea medication. To treat dehydration in a sick child, you will need an oral rehydration solution, such as Pedialyte, which is specially formulated for infants and children who have diarrhea, vomiting, or fever. These solutions contain water and salts in specific proportions to replenish both fluids and electrolytes. They also contain glucose and other carbohydrates, such as rice powder, to enhance absorption in the intestinal tract. If you can't get a pre-formulated solution, you can make your own rehydration solution by mixing 1/2 teaspoon of salt, 1/2 teaspoon of baking soda, 3 tablespoons of sugar, and 1 quart of safe drinking water. In order to help supplement your diet, it's a good idea to include vitamins in your kit. It's also essential to include prescribed medical supplies, such as glucose and blood pressure monitoring equipment. You should have a thermometer in your kit, and extra button batteries if the thermometer requires them. Check periodically to make sure that any monitoring equipment that you have in your kits is working properly. Include any equipment needed for persons with disabilities. It's a good idea to have single-use gloves and masks in the event that a family member becomes sick with the flu. Remember to have the sick family member wear the mask to avoid spreading the virus to other family members. There are also other medical-related items that need to be part of your medical kit. These include everyday items and also items that may be needed if your utility service should be interrupted. Water is essential, and you'll need to have enough stored tap or bottled water to provide 1 gallon per person per day. Soap, alcohol-based hand sanitizer, flashlights, batteries, a battery-powered or wind-up radio, a manual can opener, garbage bags, tissues, toilet paper, candles, matches, or a lighter. And remember to have extra blankets or warm clothing in case the heat is off for any period of time. Be sure to include items that meet specific needs, such as feminine hygiene products, disposable diapers, and diaper wipes. In the event of a pandemic, preparing ahead of time will help to keep you and your family healthy, comfortable, and safe.